many times have you gone into an office or they brought you on to help out and you're like, everything is good? Has that ever happened?
No.
Yeah. Alex, are you ready for the 4th of July?
No.
Even though you're not an American, though.
No.
You guys, today is your day.
I know.
Yeah.
Yay, Canada
well,
Day.
we're recording on July 1st, right? So it's Canada Day. Okay, so I have a question.
Oh.
You know how 4th of July is like built around like Independence Day. So is Canada Day built around your independence, or is it just a holiday that happened like after the fact because you guys were like, they're doing it in America, so let's just pick a day that's pretty close and we'll just call it Canada Day? Like, do you know do you know the history behind the day or not? Nope. Yeah, that makes sense. But you know the history
like
behind Independence Day, right?
Well,
I've
seen the movie with Will Smith and and the aliens.
You guys,
but,
Canada didn't have aliens too?
I am not a history type of person. I
I
don't follow that stuff. So unless someone creates a movie about Canada Day, I will watch it. But other than that, I'm not reading a book on it, and I feel like a really bad Canadian.
Yeah.
Now, so thanks a lot.
I know, right?
Go have some maple syrup and make me feel better.
Yeah, right. Nice. Well, okay, so today we figure we bring on a guest who could talk to us about, I feel like this is the one thing every dentist, like, you have to do, and no one really wants to do it, or no one really follows it, really, they should, and it's all compliance, right?
Yes.
I feel like, and I think it's tough, because we had our private practices, right, for a while before we had sold, to a DSO, and I feel like it's one of those things where you're like, I think I'm doing what I need to be doing, but I don't actually know if I am or not.
Yeah.
So I figured it'd be fun to bring Lisa on to kind of talk about all this and see, like, are we
such a
actually
fun
compliant?
topic.
I
Yeah.
know, right?
We're going to try to make this fun, right?
Yeah. So thanks for coming on,
Yes.
Lisa.
Thanks for having me. I'm so excited, and it will be fun.
Yeah. We'll make it fun. We will force fun on all the listeners.
Everyone will be compliant by the end of this.
Yeah. Right.
All right.
So if we go into it.
So when I think about compliance, I think about HIPAA, I think about OSHA, and I think about training.
Patient safety, maybe.
Them. Yeah, patient safety. Fine, maybe.
Our safety.
Our safety. Well, doesn't that all under like OSHA stuff though?
Is it? Yeah.
I don't
Maybe
know.
see this.
I think the S is
this
safety,
is why we
isn't
need.
it?
This is why we need Lisa, because us trying to do an episode on compliance would be episode done.
Yeah, that's what I think
Well,
about.
thanks for having me.
Yeah. That is the 3 things I think about.
So,
really,
maybe
like
break
what else?
down-
What
yeah.
else? Yeah, what do we need to follow? What are the kind of the categories, and then we can unravel it from there.
So I think compliance is basically, like you said, following the rules, right? But I like to start with the state board and knowing what your state board requires, because pretty much everyone requires OSHA. OSHA is who worries about the employees. If you own the practice, they don't really care about you. So
Yeah,
sorry.
that makes sense.
Yeah. So OSHA cares about employees, and then a lot of boards require the CDC regulations, and the CDC cares about you guys spreading cooties to the world, right?
Okay.
So basically, I always look at it the same way, like you kind of diagnose your patients. Like if you treat your patients, you diagnose what you're supposed to do. It all kind of works out with you, like money-wise, financially, and you get the best for the patient, right? Same thing with this. Like if you do the infection control things you're supposed to do and the HIPAA things you're supposed to do, you're safe and your patients are safe. And it all just kind of like works out. So compliance is like following those rules, and then it's following them, but then there's like the back end of all the documentation junk that nobody really knows about or wants to do.
Yeah.
Because, I mean, what would you say, because you've worked with tons of offices on this, like, how many times, and have you...
I'm afraid, yeah.
Yeah. How many times have you gone into an office or they brought you on to help out and you're like, everything is good? Has that ever happened?
No.
Yeah.
Like no one has everything under control. No.
Yeah.
Okay.
If you hire someone to help you, right? There's a difference between me going into your office versus like the state going into your office, right? So if you hire someone, you hire them, hopefully no judgment. You look around, you offer suggestions. Like You compliment the amazing things they're doing, but nobody's doing it 100%. It's impossible. It is impossible if you want to work on your patients, take care of your team. You can't. It's logistically impossible to do. I think 100%. I hate to don't
Yeah.
say that I said that's okay, but it's really hard. So and you don't know like most. I mean, did you guys learn in dental school anything about any regulations?
Nope. Don't poke yourself.
Yeah,
That's kind
which
of
I
it,
think
like-
I did. So I broke
Awesome.
that
You got
a
rule.
needle stick?
I
Did you
broke.
really?
Yeah. I got a needle stick in. No, this one's funny. So
Oh no.
this was a needle stick that I did to myself first, and then gave it to the patient. So like,
Oh yeah, that's great.
so we were at a oral surgery, like an oral surgery clinic that was like helping out like lower income people, right? And
Yeah.
and it was just like an extraction clinic. So they'd come in and they'd say, what one tooth hurts, right? You know, usually it was multiple teeth, but like, which one's the worst? And then
Yeah.
I remember I think it was third year, and we had like a week-long rotation, and we had like just learned how to give blocks and stuff like that. And someone, I think I had to work on, I don't know, pulling tooth number 19 or like a lower molar tooth. And I had my finger in, right? Because I was like, I'm trying to figure out where to go.
That's
like,
not how
trying
you
to-
do it.
I know,
Yeah.
right? Like not following the protocols. And I was like, this is where I should go. And then I normally should have had the mirror. And I
I'm
nicked
like
my...
watching this happen in my head. Okay.
I know,
Yeah.
right? And so I was going in and I nicked my finger and like just like slightly grazed it. And then went into the patient, and then pulled it out, and I was like, and it didn't hurt because, like I said, it was a graze. And I pulled it out, I was like, my glove is like
Yeah, ripped.
broken, and I was like, oh, and there was not even blood or anything from mine, so like, I don't like.
It
but
just got like
obviously-
skin follicles.
yeah,
on
yeah.
them there,
So,
yeah.
but still being like a third year student and freaking out, I was like, oh, what do I do? What do I do? And
Yeah.
I think I was glad it was that way and it wasn't the other way. So
Yeah,
it was
of course,
more,
right.
yeah.
Yeah.
So it was more me having to do, like, I think we both had to go and get like the blood draw and stuff like that, but it was more for the patient, right, to
Sure.
figure that out. But I was like, yeah, that was pretty funny.
So that's like a reverse needle stick.
Yeah. I invented
exactly.
the reverse needle stick.
Yeah, good job, Ferg. We didn't
Thanks,
think anyone
congrats.
else could do that, but yeah, good job.
Yeah.
Yeah.
So
So,
I wasn't being
that being
compliant,
said, you are supposed to try to think of strategies of preventing those things, right? So you're supposed to like use a mirror to retract and not like stick your fingers in there and
Yeah.
stuff. Like, which again, I mean, I have images of me putting my finger in there.
Yep.
Oh
So-
yeah, or how many
Yeah,
times
yeah.
in dental school, if you
God.
follow what you learned in dental school, how many 75-year-old dentists, usually
Yeah,
it's
no
male.
gloves.
It's let's be honest,
Yeah.
it's like the male dentist, right? That would just go
Yeah.
in and like for a denture try-in with no gloves and just be like, here, how
Yeah.
does this fit, right? So you're like,
Yeah,
Yeah.
you're just like looking.
just doing what he did. Yeah.
I've never done that. I've always used gloves. But
Wonderful.
but yeah, you're right.
Yeah.
They don't teach you anything in dental school. So then, yeah, you get out into real world and you're either an associate working somewhere and hopefully there's some kind of handbook, shoved in a closet somewhere that like has all of it written down, or you do what we did and have a startup and you're like, oh crap, how do we learn all this stuff and where do we get the information from? And it's like, where do you start?
Yeah, it's really hard. And especially too, like going into an office with people that have been there for a long time, it doesn't mean that they're doing the right things, right? So like you could learn maybe not the ideal way, and then you go do your practice and then you do the not ideal way. Like, and what's really scary is everything is ultimately on the dentist or on the owner. So like spore testing, right? If you're not spore testing, you're in trouble. It's not your whole team kind of gets dinged on their licenses, but you're the ultimate one in trouble. And like, how many dentists know what day they spore test in the office or if they've spore test that week? It's kind of scary.
I mean, I feel like
Yeah.
that's
make
one of
you
the big
nervous?
ones. The other one that's pretty big too, that what we're working with too, is getting like the right system down for shocking water lines, right? I feel like that's, and I feel like
Yeah.
that's a huge one.
Yeah.
And like you go and we just had a meeting yesterday and we're like, okay, which system do we want to use? Like that's easy, and how do we want to do this? And like literally all my assistants had said, I used to do this at this way. I used to do this at this office.
Yep.
And you're like, whoa, are they all right? Are they all wrong? Are they all partially right? I feel like,
I
you
know.
talk to some people, they'd be like, you have to do it monthly. And some would say, no, you shock it weekly. And then some, you have to do it this way. And so
Then
like,
it's depending on the water too. Are you having like city water or are you doing distilled water? Like other sources. Like, and then it changes everything. And then it's like, I don't know what to do.
Yeah.
All right, so let's.
So you do it all.
Yeah, can you break that down for us? 'Cause I actually need that
Yeah,
answer for today.
Yeah.
So like
Yeah.
this is helps me.
So the big thing is you've got to test and treat your water, right? And it's not the water. Like a lot of people are like, oh, we use distilled water, we use sterile water, I don't have to do anything. It's not the water that goes in the bottle. It's the traveling from the bottle to the patient.
So
right?
in the lines.
So I always think of it as like the biofilm that forms is like if I don't change my dog's water bowl fast enough and it gets slimy, that crud is what forms in the line. So you have to treat it. It doesn't matter how you treat it. Like just me being not selling any products, like you'd have some sort of a treatment straw, or you have tablets. It doesn't matter what you do as long as you're using it correctly. And some of them want tap water and some of them want distilled water. So you just have to read the instructions for that. Like,
Okay.
that's the important thing. And then when you test your water, so what people have like the 1 month and the quarterly thing, like you want to get 3 months, 1 month at a time in a row of good water before you go to quarterly. And then ultimately, the ultimate is you test and shock your water quarterly. Like that's where you want to get to. But the other thing is too, I love shocking with bleach. I love the bleach dilution. I love the whole cheapness of it and the ease of it. But a lot of reps will tell you not to do that because they're afraid you're going to put it in the chair and leave it for like 6 weeks or put like full on bleach in there and not dilution. But if you do, but I love it because I'm always thinking about the cheapest, easiest way to do it. So like to me, that's what I would do. Like I would get my office to a test and a shock on a quarterly basis. And I would probably use a tablet just because then you can shock with bleach easily.
If you like our podcast, check out Alex's newsletter, Just 2 Minutes. It's full of great advice, which makes sense considering it's her thoughts and not me sidetracking her every 2 seconds. You can subscribe at coupleofdentists.com. The link is in the show notes. Now, back to the pod. Okay, what about the straws? My team wanted to do that. You know, like the straws that can like last for a year and you can just keep them in? They're like the little blue straws. I forgot what they're called.
Yeah.
Are those?
There's a gazillion different kinds.
Okay.
Yeah, they're great. You still have to test your water. Like it doesn't mean that they're okay. And a lot of times as they get towards that 1 year mark, they start to dwindle.
Okay.
So you really need to make sure that you're really testing your water. And the big thing is you got to flush it always. And no matter what you do, you got to flush in the morning, flush in between patients, and really make sure your water's clean. And then anytime you do any surgical procedures, you can't use water, even if it's beautiful, tested, amazing water. You can't use water from the dental unit.
Ooh, okay, go into that.
Okay, so if you're doing some kind of surgical procedure, you're supposed to use either like those IV bags.
Mm-hmm.
This is my IV bag.
Mm-hmm.
Yeah.
Thing with new tubing, or Monoject syringe. This is my Monoject syringe.
Yep.
Yeah.
Okay.
Sterile saline, sterile water to irrigate with that. So you ideally would cut dry if you're using it from the handpiece from the unit,
Mm-hmm.
and then irrigate with water with something sterile.
Okay.
If you're doing something surgical.
Yeah.
Okay.
Well, you don't do anything surgical anyway, so
I know.
it doesn't matter to you. But,
Yeah.
but I'm sure that is news
But like
to
taking
people.
out like a primary tooth that's not surgical.
Yeah.
So.
Oh, is it depending on how you coat it? So if it's a simple extraction different than a surgical extraction. And
Yes. It's all about the coating.
Yeah. So it's like that. What do? Do you want to spend more in supplies and have to coat it as a surgical, or not as much and coat it as a
this
simple?
was surgical because I only used bottled saline.
Yeah,
So insurance, you
that's
need
what
to
we're doing.
reimburse
Yeah.
me for that.
Yeah.
So there we go.
Now,
Yeah.
pretty much, if you're cutting anything, you're going into bone, you're sectioning a root, it's sterile saline, and you coat it over,
Yeah. All right. That seems good. And then like flushing between patients. I mean, I'm probably guilty of not doing that. I mean, I don't.
Nobody
maybe
does that.
Yeah. Like.
Yeah.
Yeah. I don't know.
The offices that have the best water are the offices that test and shock quarterly, flush those times that you're supposed to flush. They have the best water.
Okay.
And it's just, the water's scary because, like, to me, it's kind of the biggest change that there's been sort of in recently. Besides, I think gloves were a big change years ago, and now it's this. Because people can get sick.
Yeah.
And I've heard of stories where people have gotten sick, and like you don't like. I mean.
Oh well, we've been
nobody wants
watching.
to.
So like we've been watching Gordon Ramsay has like 1,000 shows on Fox, right? Like every 2 months there's like a new version, and the one that he's got now is where he.
It's a dental show.
No. And probably next season.
That'd be really
No.
cool if he did.
Yeah.
I'd watch it.
Yeah,
But he goes into like, and this one, right? He goes into the restaurant like at night, right? He gets like a key from
Undercover.
So he's like an undercover guy, right? And he's going in and he's checking out the restaurant when no one's there. And one thing he does is, what's the test called?
I don't know.
It was something like an ATP test. It was some type of test that measures bacterial growth, right?
Yeah.
So it's
So he like swabs he swabs like
And
a
he
door
usually, like,
handle or some kind of
inside of a microwave or something they
Yeah.
use to cut like meat on, something like that, and then it'll give a number, right? And there's like a threshold where it's okay, and of course, because it's TV, right? It's always like 15 times higher than it should be. So it's like 0 to 30 is fine, but this person had 5,000. You're like, and it gets people sick. So I feel like if we tested all of our water, I wonder, do you know like what is supposed to be the standard for the amount of like bacteria that can be in a line? And then like, is that where you think?
Yeah. So drinking water is 500 colony forming units per milliliter. So that's sort of the standard. So full disclosure, I am not testing my water at home. I don't even want to know. Mm-hmm. I've gotten samples of water tests and I played with things and stuff, but I'm not testing the water that I normally drink. Or my water, like the water, bubbler thing or whatever. But like it's 500 colony forming units per milliliter. So if it's greater than that, the water is considered not safe to drink and to use.
And is that is that state dependent or is that like a federal law?
That's a thing.
Okay.
Yeah.
Okay.
So the thing about it is that this is where it gets kind of complicated. So best practice to test and treat to shock your water, right? Some states, there's only 2 states now that actively require it. The CDC says they require on a regular basis, but there's 2 states. I think I'm not going to say the right states. I feel like it's Georgia and Washington State, but it might not be. Mm-hmm. But they require quarterly testing. Everybody else requires testing on a regular basis if they follow the CDC. If they don't follow CDC, then they don't require it. However, you get a patient sick, it's still heartbreaking and your fault.
Yeah.
Like nobody wants like a Google review. I left, with a stomach bug and we had a huge infection, systemically because I went to their office. Like, so.
Yeah, yuck.
Yeah. Okay, so it seems like you said, get the tablets, do those monthly until you've proven that you have clean enough water, and then try to go out quarterly.
Yeah.
Okay.
Yeah, so have the tablets always.
Okay.
And then test for 3 months in a row, get nice water, then go quarterly.
Yeah, keep up with the tablets. Yeah, keep up. Yeah, cleaning them, but then you don't have to test it, and every 3 months.
Okay. That helps. Okay, next one that I always thought was fun.
Okay.
Sterilizer, because that's another thing we like took a course in dental school, right? Like
right.
Did we? I don't remember that.
Yeah.
I don't know. This instruments just came back clean. I don't know.
Yeah.
Well, they do. You just go to the dispensary and they give them to you.
Yeah.
I know. Yeah. Like, these are good.
Yeah. Little did they tell you that like that autoclave is like so much money.
Yeah.
And you're like, are you kidding me? Anyway.
Oh yeah, that's one of the biggest shockers. You're like, this thing is like $6,000. Okay.
Yeah.
The one my team would ask me this all the time, and I was like, I should just write it down or it should be somewhere, but I never know how to put the packs in. Like, do they go up or down? Like, what's the right way?
Yeah, the pouches.
The deal is most of them you follow whatever the recommendations are in the, the autoclave, right? So like some of like the Statums like have these racks that you actually put them sideways. Mm-hmm. So those are kind of cool. But if you're putting them as of today, I didn't even check the news today. But as of today, you would put paper down because if you think about it, if there's extra water in there and you put the plastic down, it's just going to pool up in there and hang out. So if you put the paper down, at least it has a fighting chance of drying. But the big thing about autoclaves is that if something goes in wet, it's coming out wet because the autoclave only takes out the same amount of water it puts in. So if you don't dry your instruments going in, they're not coming out dry. Mm-hmm. And you also have to make sure the big thing people do, no matter how they do it, is they don't let it run the whole cycle. They open it up in the middle, and you got to let it run the whole cycle.
Okay, wait. So back on the wet one, just so I understand, because I'm naturally such a clean person that this just comes into my head so easily. No. So if you then took an instrument, you run it through, your you clean it out, you get it where it's got to be. It's not completely dry and it's still a little wet. If you put that in the autoclave, you ran it, it comes out wet. The indicator would still come on potentially that it's sterile, but is there a chance it's not sterile then?
So it's sterile while it's in the environment of it, right? So in theory, if it's a little bit wet and you leave it in the autoclave and you keep it, closed, you let it go through the drying cycle, hopefully it should dry. If you take it out and the package is wet, then wicking comes into the world.
Yeah.
And wicking is basically like if you were to touch it with your hand, the wet part, all the germs get sucked in. So if you extrapolate on that, you leave it out in the air and the germs get sucked in. Or you put it out on a dirty counter to dry and the germs get sucked in. So no and yes.
So you're saying
if it dries, you really want them dry.
So a full cycle includes the drying time.
Oh yeah.
Got it. Okay. Well, I mean, I've been guilty of that too. Pull it. We got to pull it before it's done its steam cycle and it's coming down and it's it's just drying. It's well, I need an instrument in there.
Obviously, if it's an emergency, right, and you need something oh my gosh, I need this, you could go in and pull it, open it up, use it immediately.
Yeah.
I mean, that's a different thing.
Okay, so that's still good.
Okay, cool. Good.
How, when you're separating in the lab, I just have so many questions.
Oh, gosh.
This is fun.
I'm afraid,
I know.
What?
So, when you're setting up your lab, though, right? I think the other thing people are always you have your clean side and dirty side. But to me, is it kind of like having a smoking section and a non-smoking section in a restaurant? Because you could sit in the non-smoking part, but the smoke doesn't just stop behind that the invisible barrier where it ends. When you have a clean and a dirty side, does stuff in the air is going to move. So is there really ever a clean side?
I mean, yeah, I agree with you. And especially those handpiece machines, those are amazing. But even when they're closed, the aerosols come out. So having that way on the dirty side, I think, is really important. But obviously, yes, the smaller that your stereo area is, the more that it's gross, right? Yeah. I mean, ideally, I suppose you'd want to take out the stuff from the autoclave and move it, into the next room for storage or something. Most people don't do that. So
yeah, I mean, most offices, they don't build, when we did our startups, that wasn't something we were told you have to do. So I guess, are you still considered are you still considered compliant, and is it still considered generally safe to keep it?
Yeah.
Okay.
Well, that's what I was going to say. You have to be a little realistic, right? I mean, the ultrasonic, when you're using it, the cover should always be on, right? I think if you're using the ultrasonic and the cover is off and you have the handpiece machine going, I don't know, maybe I wouldn't open the autoclave just then and take the stuff out. Maybe I'd wait a minute, right? But the bigger thing that I notice is the gloves and the cross-contamination. There'll be someone working on the dirty side and then, the autoclave's done. And then they'll take those gloves and use them. So that's gross. Mm-hmm. I think that realistically in if you do a risk benefit analysis, they're clean in a normal stereo area where you have separation.
Yeah.
Cool.
I mean, none of this,
well, yeah, we're not in a vacuum. That's not going to happen.
We don't live in a bubble. Yeah. So I mean, there's probably a base level of stuff that everyone just has exposure to.
Yeah.
Right. I mean, you're not going to pick stuff off of the floor and put it on someone, but just if you pick something off the floor in your house and you use it, you'll be okay. So,
Yeah.
But don't pick things off the floor and give it to patients.
That crown that went flying.
Yeah.
And you're oh shit, I got to find this on the floor.
There's not a 5-second rule. Is it a 2-second rule?
No.
All right. So that's a lot of the infection control stuff. Yeah. So I saw, are they changing HIPAA?
So yeah and no. So we have been waiting for HIPAA to change for years because they're supposedly going to change it. They made this whole thing, I think in March, this whole long thing. It basically what they changed with this whole sort of risk assessment you're supposed to do of all your stuff and all your your server and your backup and all this kind of stuff and kind of evaluate it. And then it went on a pause. So I don't know. So we have our clients, we think it's best practice to kind of know, your security levels, right? Because so many people are getting attacked cyber wise. So like it is probably best practice to do the things that they, maybe not as obnoxiously as some of the, the regulations, but like it is best practice to do it. But HIPAA, it was in like a, waiting period to be approved, and then it kind of stopped.
So, I mean, I guess technically if you just had like a good dental IT company, they would probably keep you.
So that you just want to make sure you have a really good IT company, because a lot of people have IT companies that are like work on their software and stuff, but you want like a managed care thing, I think it's called. Like we have like one of my employees she took her computer with her. She was with her son looking at colleges in other states, and our IT person couldn't get in touch with us fast enough and shut her down. He's like, why is she in Tennessee? You guys are not in Tennessee. Like, he was like, no one should be using your stuff. So like, that's what you want. You want someone that's like in the middle of the night, if someone's like on your system, they can tell, that kind of thing. Like, you just want to double check that it has, that it's actually protecting you.
Yeah. Okay. What about, which one was I going to go into next? No, it was the one we were talking about it recently, Alex. This morning. This is where my memory goes with like 3 kids.
We were talking about compliance this morning?
Oh, yeah.
Yeah, that's what we do. That's how we start our morning. Yeah. Instead of like, how's your day going? It's like, are we going to be compliant today? That's how we start it.
Yeah. I'm going to ding you.
Yeah. No, I usually start out in the negative somehow.
Do you have like a checklist on your fridge or something that you like?
Yeah.
Yeah. Good.
Definitely. I love checklists. Live and love them. We all know Eric wants more friends. If you're enjoying this episode, share the podcast and then tell them to DM Eric so he can hit his quota of 1 new friend per day. Now back to the episode. And okay, so what about training your staff? So we had someone with our whole, like, we sold to DSOs and stuff like that. So I will not take the blame for this. No, just kidding. Someone came in and was like, okay, where's your emergency protocols? And I'm like, well, I don't know. We have an exit sign and a fire extinguisher. Like, what are you talking about? And they're like, no. You need the step-by-step guide of what you need to do in the event of whatever, of this emergency. So I remember like taking like, I don't know, an hour and like, okay, this week we're going to do our fire protocol. And it's like, what does everyone have to do? And like, this is another protocol if someone comes in with a gun. Like, what does everyone have to do? Is that a thing? Or
I mean, it is in the military, because now you like brought back some like military dental PTSD, right? Which isn't now. But like, we used to have to do that. It was every month. It was a different training, I remember, and it was like 1 month was this thing, and then 1 month was a different thing.
Does that fall under like compliance stuff? Like who would ding you on that if they didn't know you had that?
Well, so it's OSHA, right? It's keeping
it's still OSHA.
Safe.
Okay.
Yeah, I mean, and different things, like depending on what kind of sedation you need more, regular defined safety meetings. I mean, we kind of are people, like, we think every month is good. So kind of what you said, every month picking a medical emergency or picking like a fire or picking something and going over it. I've noticed that like doing it like that and breaking it down makes it way more effective. Mm-hmm. And then the big thing about it is documenting it, making an attendance sheet, couple bullet points about what you talked about and who was there, and then you can show proof that you did it. Mm-hmm. And having like new employees, showing them, having a medical emergency book, having showing them what your plans are for certain things, I think is really important too. Who would ding you, I mean, yes, if they want you to have all these things written out, but it would be more of like something would happen in an emergency that wouldn't go well, and that would be not good.
Yeah, so it's you need to know it, but you also want to have that and document it, because if or when something happens, your case looks better if you're like, we have been doing stuff, and like we aren't, like this was kind of like, it was an error, but we were doing the things to hopefully have this done correctly. It just didn't go right? So it probably looks better.
And then also like doing it and practicing it versus having, like, we do both, right? We do like medical emergency classes, right? Mm-hmm. I don't think, I mean, you try to make them interactive and fun, but like no one's paying attention, right? Yeah. So like, breaking it up every month and being like, okay, this month we're going to do this and talk about this. Like I was in an office and we did a whole thing. They pretended to save the person. Great. This person survived. And then we're like, all right, let's rehash this. And like, what do you guys think? And like, no one ever remembered to tell the front desk to call 911. So like in a real emergency, this office will never forget to call 911 now. Right. So I think things like that, like kind of acting them out a little bit, 10 minutes, like it doesn't have to be like a whole day. You don't need like a dress rehearsal. You just kind of do it.
Yeah.
No costumes.
And scene.
And scene, right. Done. Like, yeah. But just doing it in your office and like really trying and seeing and then being like, all right, like that would have been more efficient if we had done it this way or like whatever, it's just because it could be you that has the emergency. It might not be a patient, and not that you're more important, but you want to make it so that everybody is safe there.
I mean, that makes sense.
So like, because I think what ends up happening like with a lot of dentists, right? If you're trying to do it solo and you're like, I'm not going to have anyone do this, is you're just hoping that something bad doesn't happen. Can you scare us a little bit? And do you have any stories where like people didn't do stuff and like the fines were actually legit? Because I tend to work off of fear, so like I'm more likely to do something if I know like there's a potential that something bad can
consequence.
happen.
Yeah.
I mean, in general, right? Anything like I'm obsessed now with the DEA and having controlled substance records, and those are like hundreds of thousands of dollars if they come in and if you have controlled substance and your logs are not line item by line item where they need to be. It's so scary. So like that's my new kind of obsession, getting people to like do those correctly. Nice. But like anyone, I mean, at least here. And I think a lot of boards, like if a patient doesn't see something they like, so like if a patient doesn't see you wash your hands and they decide that that's gross and you're gross and they don't like you, they'll complain to the board. Mm-hmm. And if they complain to the board, you're done unless you have everything how it needs to be, right? So the board gets all of your documentation, all of your chart notes, all of your everything, every communication you've had with this patient. And they may say to you, who cares? You don't wash your hands, no big deal. But look at all this other crap that you're not doing, or look at your case notes that you're not. Like,
yeah, it just opens you up to everything.
Yeah. Like chart notes and stuff. Like I have a couple obsessions apparently. I'm obsessed with that too. Like I love looking at people's chart notes and being like, all right, guys, like fix them. Because if somebody sees these and sees this and you in your head know what you did, but you didn't write it down, or you wrote it down differently, or you commented some way, like you're going to be in so much trouble if anybody complains. And anybody can complain about anything. Like that's the scary thing, is like people are a little bit obnoxious right now and they're very complain happy.
Yeah. Yeah, I believe it.
Yeah, that happens. I mean, it's little things too, right? Like, I mean, especially I think it's with all the COVID stuff, right? Like I remember I think we had a patient or two at one of the offices had said like, oh, there was like dust or something somewhere, right? And it's like, well, everyone's so heightened already and aware of anything, like especially when COVID was going on, that I feel people are on the lookout for it more, right? Like there's like a scuff mark on your wall, right? Like stuff like that. And it's like, okay, like that's not anything, but people are looking for things.
Because I beat up the last patient in there. Too.
Yeah.
Yeah, it's fine. Don't worry about it.
Yeah.
But like that's the thing, is like it's like COVID to me, I feel like I always say like it gave people like an infection control degree from a really crappy school.
Yeah.
Because like they don't know, like exactly, they'll be like, oh, there's a scuff mark there, you know what that means? And like, no. Like that doesn't mean anything. That just means you need to paint there, whatever, like, but they will complain about that where, they may see, I don't know, open instruments in the drawers and not even complain about that. So it's like, it's just scary because you don't know what, but I definitely think COVID sparked it.
Yeah.
So, I mean, like, okay. So like, again, going back to me on this, like,
yeah, bring it on.
Yeah. This is one thing that you have to do, right? But like, the dentist doesn't really want to do it. So like when people hire, say, companies like yours or compliance companies that help with that, how much of it ends up being like set it and forget it, or and how much do you still have to actively do? Like how do you guys help?
It depends, right?
Okay.
Different companies do different things. I mean, what we try to do is give you a structure and a platform to do it on, where we have like we'll say, okay, Tuesday you sport test, Wednesday you water test. Here's a video on how to do it. Here's like, and then on next week, where's your sport test? You didn't do it, but you still have to like companies can't be in the office and do this stuff
Totally.
for you, but like,
It should.
we at least try to make it so it's totally.
So you guys kind of help
yeah.
more with the, like, you guys will help with like the accountability part, because I think that's the biggest piece, is like the dentist is like, all right, now I have to go tell my assistant to do this. I don't really know what to do, and so I'm not really good at training my assistant to do it, and they don't.
Well,
they,
it's
they
not the
may
account.
forget it.
It's setting up the whole process in the system. I think that's what she's saying. They'll help them out with that. You still have to be the one that is accountable
obviously.
and saying like,
but
did
you
this
guys-
get done? Because it's on you.
Yeah, but do you guys still help with, like you said, the sport test example? If it wasn't done, like, do you have? Will some offices like give you the stuff to say like, look, we did this? Like, because I feel like that would help me or the team, as if I had to.
So
give
we
them
have. Well, I mean, at least for us, like, it can only speak what we do. We have we have a digital version, right? You put in your log, and then you take a picture of it, and you show us that you either mailed out the envelope or you did your in-office sport test, and here are the results, right? So if we don't see that, we're going to reach out to you.
Yeah.
But there's other things too. There's like stupid OSHA forms you have to fill out throughout the year. So like trying to break it up, like I always joke, like, so you're not up like, New Year's Eve doing like all the whole yearly things, but like breaking everything up. So it's like, I mean, I don't know. Like, I think compliance, if it's set up in a program, it could take you on the ground half an hour a week.
Yeah.
Okay.
That's
to
doable.
Like,
get things done.
Yeah.
Something like that. Like, it just you need a process, and whether it's like doing something like ours or like having in your book, like, exactly what you need to do, just having something organized. And then the big part about it that we've noticed is if you decide to go on vacation and you're in charge of sport tests, Eric, who's sport testing?
Yeah. Right. Probably no one.
Yeah. And that's a big deal.
Yeah. I
So
know
that's where it's like,
there's
like
two things. One
cross-training,
is
right?
like
Yeah.
training, and I think that's such a big thing is just staffing. And it's like you train someone and you're like, you're this person, and then they leave a month later or whatever, they quit, they get fired, whatever, and then you have to train this whole new person, and then things just get forgotten. And it's like, okay, the most important things, sport testing to me is up there, but like the emergency protocol stuff is like, I'm sorry, you're now not the 911 person. I don't know who is. I don't know. Sally from like 6 months ago was, but she's not here anymore, and it's just such like it's just that's a headache.
So that's where I think
It's
it would
such a
be
headache.
nice is like I would easily pay some company to like help me with management of it all. So it's like you've got your list of you have like the master list of everything.
So I love checklists. Okay, that's like my love language, and I tried to put through, like, in ChatGPT, I was like, create an OSHA checklist for me. It was like 400 items, and I'm like, okay, no. And I got so, like, discouraged, and I'm like, okay, I'm not going to, walk down this path. This is kind of crazy. But I was like, can it be manageable, or is it like, no, they, like, if someone does come to your office with, like, their checklist, like, from OSHA, they have, like, 500 things that they're checking off and like, making sure everything's kosher.
Yeah, most of the things they're checking off, a lot of it's like the CDC stuff, which is everybody overlaps. It's kind of a little incestual, but like there's things that are big deal things, right? So you focus on those things, and then the things that are sort of nice to haves, obviously, are great. But I mean, when I go in an office, like, and do a walkthrough, like, I will then make a report and be like, okay, so here are the things that are really important that you need to do today, like get a new AED pad because it's expired from 2018 or something. Like, and then like slowly get everything to where it needs to be. Like, it doesn't happen instantaneously, but it's definitely not a 7-page checklist.
Okay, cool.
If you do things, if you get things where they need to be, you don't have to keep on checking them, and then it gets kind of you manage it over a period of time.
Okay. All right, cool.
Yeah.
I just remember it's a funny story, like setting up our offices, like our startup. We have a very minimalistic look. Like, we don't have a lot of cabinets in the ops. And it's just like very minimal counter space, all of that. And we're like, where do we put our sharps container? So we had to put it on the floor. And I'm pretty sure that's a no-no. And so I remember telling the staff, and this is when I had like a couple staff because we had just opened. I'm like, if OSHA walks in, everyone needs to grab the sharps container and put them on the counter so that no one knows that it's like on the floor and we don't like.
It's like when you're in like college at like a house party and everyone's under 21 and you're like, if the cops show up, grab the beer, we're putting it out. Yeah.
I know, that was like, everyone make sure you grab that, because I know that was wrong, but it's kind of one of those things, I don't have space for it, and I would rather it be in the operatory. I thought it was safer than having to like transfer it and stuff.
Alton, it kind of is an oversight, because like when you're going through the process of building a practice too, or even acquiring one that's probably been that way for 40 years and probably hasn't kept up with everything, is it's not like when you're talking to the contractor or the architect or the design, anyone like that I feel like that does get missed as an oversight, because yours is probably not the only office that they were like, where do we put this? I would think that is very often missed, because it's just an oversight.
Yeah.
I know, that's why I always like feel like people call me, like they'll be like, we're starting a practice and it'll be open in 6 months. I'm like, all right, that's great. I want to see your plans. And I want to see, like, let's talk about where, make sure, oh, wait, you have, I don't know, like, this is totally backwards, or, where's the eye wash going to be? Everyone always gets really fancy, nice faucets, and the eye washes don't fit them.
Yeah, they don't screw in.
You need the really old, cheap,
yep.
Like Home Depot, like really the cheapest faucet, like, and so like stupid things like that are not in the plan. So like, that's why it's good, I feel like, to get some kind of advice. Before you spend all the money on everything.
Well, because but shouldn't that be like? I think we maybe assume that. I think maybe we wrongly assume that is like considered good to go, because when you're doing the startup, right, you have like fire inspections, you have other inspections. Like people come in, they check everything, and you think, okay, if this got a pass, then I'm good to operate a business. But there really isn't. There isn't like some government agency that comes in to make sure you're OSHA compliant before you open, right? Like you're allowed to open without, or do you have to?
No, yes and no. I mean, like they'll check to make sure you're ADA compliant and like your fire and all that stuff. So that's obviously like OSHA-ish.
Yep.
But no one's coming in like I'll go into offices that have just started and like, oh, I didn't know we needed an emergency kit, or I didn't know we needed, whatever, lead aprons if they needed in that state, or an eye wash. Like, there are things that are state required and the board requirements that people don't know. There's no one coming in to check that usually, unless you do a sedation permit, and that's when they'll come in and look at stuff, but most offices don't. So then, no one's looking at it.
See, like, and I'm not even for like the government being in my business with stuff, but it seems like that would be a decent thing, is like there's some type of person that comes in to make sure everything's checked and good. Because then it would suck on the back end, right? Like you end up getting, like you said, like you didn't have something set up, and now you get a fine of $100,000 because you weren't like compliant with your meds and stuff like that. So I don't know. I feel like that would be a good thing.
I know, it's all about just. I feel like not covering your butt, but making sure doing everything, setting everything up well, and starting with like really good processes in the beginning, like not letting people decide, kind of. Yes, people can put their input in, but like, kind of having one way to do things and in the correct way, and just going from there. Yeah.
Yeah.
All right. My last question, and you may not have the answer to this. You can let me know if you do or not. All right. The one thing that I see on like Facebook posts that no one has a good answer for, and everyone has to piecemeal together, is emergency kits. The company that we've used for years, I feel like the markups are so freaking ridiculous. The contract sucks. I'm sure they are just making a killing off of just generic stuff they're doing. Is there a good solution do you know if they're a good solution or a good company or someone that you can just get your emergency kit stuff and it's actually like reasonable?
Yeah, there's yes, I agree with you. And then every state too, so you have to know your regulations. So like our Massachusetts, pain in the neck, there's a gazillion things you need for everyone. A lot of states there's not. So you have to know what you actually need and what you don't need, because that kit you're talking about, which I think I know what you're talking about, comes with so much stuff. And they give it to you like you get like multiples of them, and it's
I
Oh, and
know.
they
It's like
mail
they
it,
keep
like-
sending
and then-
you stuff, and you're
well,
like,
and
I
they-
didn't use this.
Well, and the expirations like never line up either. So it's like, here's a $300 charge for this one thing, and you're like, okay, I guess I need this. And then it's like 2 months later,
Yeah.
here's another charge for this, and it's like,
I know, and it's like,
sucks. The
this
system
this
is
hasn't even
terrible.
expired yet. So now you have 2. We got to send them back, and
Yeah.
and you're like, someone
Yeah,
deal
so-
with this.
I know a couple companies that so Protect It Dental, if you look them up, they have a pretty good deal. They're a little bit, to me, a little bit more ethical about the way that they have their auto renew thing. Patterson just started this Vital Alert kit that seems to be cheaper than a lot of the kits. They actually, I think, send you a brand new kit each time. So they keep track of it. But anything that you can do, you just need to make sure you need the emergency drugs that are required for your state. I think every office should have EpiPens and an AED, regardless of them being required or not.
Yeah.
But the other things just don't. I know all those vials of like the diphenhydramine vial. I'm not using that.
Yeah.
No.
So it's
I
like,
know.
okay. All right. Then my head just went, because this is how my brain works. We bring up one thing, and then like another thing pops in my head.
Yeah.
So
I said that was the last. Now this is the real last.
Okay.
it's fine. I got like all day here
Nice.
looking at the doors. You can
po-
pick
po-
which door you want to open at the end.
Yeah. Right. Oh yeah. Yeah. What's behind door number 1? The posters.
Okay.
So compliance posters. That is what I was talking with you
Oh,
about
okay.
earlier today,
Oh,
Alex.
sorry.
Was those? There's always been that stuff about it being the poster itself, not a scam, but the companies that force you to pay to get the poster, right? And they say, pay me $50 or $100, and we'll send you your state's posters. Can't you just get that stuff for free, and you should never pay anyone to do that?
Yeah, so a couple things. You can also get them on this store called Amazon. They have
This
you want a
little
federal
store.
poster and a state poster, and then there's some kind of like random OSHA postings you want throughout your office. But like we have, like on our platform, we have all the posters. If you wanted to print them all out, they're not going to be pretty. Like they're not going to be in that whole like space saver thing. But you could literally you could go onto your state's website and print out every single poster that you need and not pay for any of them.
Yeah. Yep.
So yes, I think that some of them, there's a lot of cost.
Okay. All right, so that's a free option.
That's a tip for
Yeah.
everyone that gets, because I've gotten those in the mail,
We
and
see
they're
them
like
all the time.
and usually, I just throw them out. But
And I'm sorry.
no, go ahead.
As you're saying that, be wary of when you get things in the mail that say, act now. You have to. There's a rule that you have to have this training by January 1st, or else you're gonna explode. Like there's no such rule like that ever. So just be aware. Like take a breath and see what your state requires.
Yeah.
Before, most places don't have like a specific date. It's usually within the license cycle.
Cool.
That makes sense.
Yeah. That's good. Yeah. So do throw those out, because they're addressed to you. It looks official. You open it up and you're like, oh,
They
this looks like a pretty legit form.
Yeah.
And then you start reading it and you're like, nah.
No, there's like always one thing that's weird.
Well,
You know, on it,
I
and
never
you're
like
like-
when they're like, send us, for $50. It's usually like $50 or something.
Yeah.
Like, nah.
Yeah.
Yeah. So watch out for those.
No, you helped answer a lot of those questions that
Yeah.
I feel like all dentists should know, but I bet you if you polled all of us, I don't know if we would know all those all the time, right? So
Thanks
Thank
for
you.
I didn't know that
setting the
before.
record
thank
straight.
you for being the one that takes one for the team and does all the compliance stuff.
Yeah, and
You're
learns it
welcome,
all
thank
and
you.
stuff. Yeah.
But yeah, thanks again for coming on, and we'll have to do more. And when we come up with more questions, we'll just bring you on. You'll be our
When more
compliance
questions
person.
happen.
Yeah. Thank you guys for having me. This was great.
Cool.
Appreciate it.